Hi, I'm Tova Walsh, and I'm an associate professor of social work at the Sandra Rosenbaum School of Social Work at University of Wisconsin in Madison.
And I'm Craig Garfield. I'm a professor of pediatrics at Northwestern University and Lurie Children's Hospital in Chicago.
And we are very happy to share with you the video abstract for our piece on perinatal mental health, father inclusion at the local, state, and national level, forthcoming in Health Affairs. This will be included in the second of two special issues on perinatal mental health, and we are really delighted to bring a focus on fathers to this issue. So fathers have a dual role in the perinatal period as both partners and parents themselves. As partners, fathers' support for mothers is associated with improved maternal mental health and well-being. When mothers are struggling, fathers can help to buffer the impact of maternal mental health challenges on child well-being, and fathers can play a critical role in helping mothers to identify when they are in need of care and access needed care.
For fathers as parents, we know that there's a higher risk for mood and anxiety disorders in the perinatal period. And we know that mental health impacts parenting, family relationships, and child development as well. We also have been learning that for fathers, depression may look very different compared to mothers, and that's an important thing to think about in this particular space.
So we have a set of recommendations to offer at the local, state, and national levels. At the local level, we want to highlight the opportunity for cities and counties to support father engagement by creating entities that are dedicated to focusing on fathers and supporting their inclusion in child and family services. Alameda County Fathers Corps being one excellent example. We also want to highlight the opportunity for home visiting programs, which are really widespread nationwide, to attend to how they involve fathers and to make steps toward increasing engagement of fathers in home visiting.
Recommendations at the state level include creating commissions on fatherhood. Some states already do this, and Ohio is one example here that has a commission on fatherhood that can help make sure that the state is thinking about families and family formations proactively. Another recommendation is the inclusion of fathers in the MCH world that most of us work in, including something very simple, adding the word father to the mission and the goal of the state MCH work.
At the national level, we're calling on professional associations like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and others to focus on fathers' role in the perinatal period and focus on fathers' mental health by learning more about the ways that fathers present with depression and thinking about including all parents, not just birthing parents, but all parents in efforts to assess parent well-being around the period of welcoming a new baby. One organization that we want to highlight that is really well positioned to support this work is the Congressional Dads Caucus, which is a voice for fathers in Congress. We also want to highlight a recommendation around national data collection. One of the limits of our ability to serve fathers is not knowing enough about what fathers experience during pregnancy and in the period after welcoming a new baby. Prams for Dads is an effort to gather actionable health data to learn about fathers' experiences across pregnancy and early parenting in order to inform action to engage fathers more effectively and promote child and family well-being. So we are delighted to share these recommendations with you. We look forward to engaging with you and furthering this conversation and hope you'll read the piece and reach out to us to continue the conversation. Thank you.